Thank you. A huge thanks to the judges and to everybody who showed up tonight. My name is Leah Brownlee. I'm the president and general counsel.
And hello, everyone. My name is Eugene Malinsky, and I'm the CEO and co-founder.
So a couple quick disclaimers. Our arthro-free device, which is being passed around the audience right now, is not FDA approved yet. Also, during our presentation, we're going to tell you where we plan to be, but it's not a guarantee.
Right. Thank you, Leah. So I want to start off with noting that at this conference, as everybody has noticed, healthcare really is the frontier of innovation. We have seen tremendous work by a lot of the industry partners, but there are still significant areas in our operating rooms where endoscopy really does remain decades behind. And one of those is the fact that we still have to have cables in 2021 from the surgical tower across the patient, across the floor, and then to the surgeon's hand in order to do pretty much any minimally invasive surgery. There's a lot of cables in that operating room. And the endoscopy market really is a $54 billion market that is growing, and it is poised for transformation. I am incredibly proud today to introduce the arthro-free system. It is the world's first fully wireless, minimally invasive surgical camera platform. It is being passed around, and we will also have a demo station after everything is done where if you hadn't had a chance to try it, you are more than welcome to. So the arthro-free system is very much a safety-first system, and one of the first things that we considered was the fact that we wanted to create a system that was as easy to use, but also very easy to sterilize. Unlike current wired systems, we actually can fit the entire arthro-free system into a single sterilization kit and then go through a STERRAD system. So I think everybody knows the picture on the left. You have your standard surgical tower, you have a wire going to your camera, and then you have a fiber optic for your light. And then on the right, you have the arthro-free system. It is a drop-in, universally compatible system. And that is a very important point. What that means is that we are able to bring in our system into virtually any environment, ASC or hospital, and set up in about 15 minutes and eliminate those cables that everybody has to use today. And then arthro-free, very much, again, as I said, is a safety-first system. Without wires, you minimize your risk for infections. Without wires, you minimize the risk for the surgical team to trip and fall over those cables. And very much, you minimize the risk of those fires. Due to our patented revolutionary Meridian light engine, you virtually eliminate the risk of fires from the fiber optic cable. And a very important point, with a faster setup and a faster takedown, there's the opportunity to perform surgeries faster, which means potentially an extra surgery a day. So I want to come back to the safety factor because it is so important. As everybody knows, on the left, fiber optic cable, very much capable of setting fire to a drape in under 2 seconds. On the right is the arthro-free system using our Meridian light engine. Indefinitely, you can keep it there. It will never set that drape on fire.
As Eugene mentioned, our Meridian light engine will make operating rooms safer. So how many of you have experienced an operating room fire? The max temperature of our system is 113 degrees Fahrenheit. It's the warmth of your cell phone. It is set to transform lighting in the operating room. Here we show the form factor that's on the arthro-free system in front of the Stryker 1488 light box. We simply use less power with our lighting technology, approximately 5 watts as compared to their 400-watt LED light source.
Thank you, Leah. So we have a two-step market entry strategy. At first, we are actually entering the orthopedic market, specifically arthroscopy. Arthroscopy is a $4.1 billion market with approximately 6 million annual procedures. And then shortly thereafter, we're looking to enter the endoscopy market, more broadly general surgery, lap, GI, all of those surgeries. Much bigger market, as everybody here knows, about 13 billion and growing very rapidly to 16 billion, and about double the procedures at 13 million, just laparoscopic procedures per year. And we have already had a significant demand for our system for it to enter the broader endoscopy market. Both here at SAGES, at our booth, we have had tremendous support for our system, as well as outside. And we've actually even done demos and tests with our system, as you can see on the screen, with both rigid as well as flexible scopes. Before I transition back to Leah, I want to leave everybody here with two important quotes that we have heard time and time again since we started the company. One, that a wireless camera would be a game changer. And two, where has it been all this time?
Thank you. Before we bring our system to your operating rooms, we need to get FDA approval. So right now we're in verification and validation testing and expect to submit our 510K by year end. After that, we will hope to get FDA approval early to mid next year. Our indications for use for our 510K are broadly all of minimally invasive surgery. And to make sure we stay in your ORs, we have to have a strong protective foundation of patents. So we have patents issued around the world and in the US on both our light source and our wireless medical camera. Our intellectual property was developed in-house at Lazarite. Eugene is one of the inventors. So we own our IP, and there are no third-party claims to it. So who are we? We're a small team of experts that have been working in the life science industry for decades. Eugene, as I mentioned, is an inventor of the technology, co-founder of the company, and the CEO. He's a serial entrepreneur, and his last company, Dragon ID, was a medical device consultancy in the orthopedic space. Myself, I have 16 years experience in the life sciences industry, both at big law firms working for venture and life science companies, as well as an executive in biotech. We also benefit from an expert board of managers. Our board chair, former hospital administrator and orthopedic surgeon. We have the CEO of OrthoFix on our board, as well as a very important financial expert in the US. We have fantastic advisors as well. We manufacture at Minitronics Medical, Avid, and Energy Access, all located in the US. MICRA will be submitting our 510K on our behalf. Their team has decades of experience working in the FDA, in the medical devices division. And our collaborators that we've recently announced include the Center for Health Affairs, as well as university hospitals. So in the next 12 to 18 months, we're going to go from being a pre-revenue company to a revenue-generating company. So we're going to be super busy. And we plan to be able to deliver devices to customers as soon as we get regulatory approval. But back at home, we're not stopping our R&D. The goal of our company is to remove the wires from the operating room. So we keep on working on that. And our light source technology is innovative and will transform industries. And so we're working a separate pathway for medical lighting and other industry lighting applications. So far, we've received some accolades. We went to our very first conference a month ago and won one of the innovation awards at the AOSSM conference in Nashville. Other traction that we've seen, more than 50 physician investors as of today, and we've raised $18.5 million to date. So why are we here? GI is a really important market for us, and We need to do demonstrations. We want to be in your hospital systems. We want to be working with the doctors that are committed to innovation. And we want to make sure Arthro-Free has a place in your practice, and also that you have the ability to give us feedback. And as soon as we get market approval, we need a couple hospital systems to be doing studies with us. So I think this is the point where we ask you for your questions.
So we'll turn it over to the judges, and then if there's anybody in the audience who wants to come up and ask a question, I believe we have some microphones where you just come up to the table here and we'll give you a mic.
Very interesting device. Thank you for a very nice presentation. The operating room is full of all kinds of sources of radio frequency interference, most particularly from electrosurgical devices. And how concerned do we need to be about the possibility that using a Bovie device is going to cause interference to these wireless signals?
Fantastic question, and one that has been asked pretty much since we started. We both officially as well as unofficially have run studies. This is actually pictures from an official study on signal coexistence. We performed what would really be an impossible operation. We had the Arthro-Free camera system in a cadaveric knee, along with full power Bovie, along with a shaver, and all those off screen, but also full power drill. So there is actually no concern on signal coexistence. We use a military grade encrypted wireless system that is a non-interference systems with Wi-Fi, cell phones, and all of those sort of things.
Leah and Eugene, great presentation, thank you. As you transition from a pre-revenue company to a revenue-generating company, can you speak as to the certain key metrics that you'll be focused on?
So as we go to revenue generating, the first thing we do is we build our team. And we build the ability to deliver. So when you're talking about key metrics, the number of systems we can deliver into an operating room is big for our sales force. But we also are planning studies that will help our customers be confident in our system. So we're planning efficiency studies and other studies immediately post-approval so that we can deliver data that is important to the customers.
Well presented, and enjoy the product roadmap. I have three questions. Number one on the regulatory one. What's your predicate? That's number one. And then second question is with respect to the technical aspect. I gather it's a battery powered, is it?
It is a battery powered system.
How long does it last?
Right, okay, so let me actually go back. Our predicate, so this is a 510K application. We actually have a full set of predicates that we developed with MICRA, along with all the testing that needed to be done, which we're literally in the middle of conducting, and so far our results look fantastic. But our predicates are, in essence, currently existing tower systems for some of the video stuff, and then for the wireless aspect of it, we have another predicate, and then the light engine itself is actually considered a bulb. So it is an eye-safe. Well, don't stare at it, but it is considered an eye-safe light engine. So we don't actually need a predicate for it. And then for the question about the battery, that's a good question. If you haven't had a chance to get your hands on the Arthro-Free system, it has a battery in it. It's actually a very small, very light battery. Our battery will last 75 to 90 minutes, and it takes about 10, 15, 20 seconds to change from one battery to another, and the batteries are sterilizable in the tray.
These are disposable batteries, or you need to recharge it?
No, rechargeable.
I see. Okay. And your source is compatible with all the scopes, both flexible, rigid, and 5 and 10 or 3 millimeter scopes?
Yes, and so we actually have built an entire compatibility list. As we've been going around and testing our system around the country while we're doing our studies, we've built a compatibility list. We've done 2.5 millimeter all the way through 50 millimeter for rigid scopes and telescopes, and we've done a number of fiber and flexible scopes on the business end. And then on the other end, our receiver, as I mentioned earlier, is also a drop-in system. We have tested our system, and it plugs in with a number of the systems that are currently in operating rooms. I don't necessarily need to mention names, but point being is we've pretty much all the big ones, we have tested our system, and it works very well on them.
Thank you.
We have a question from the audience.
Yeah, hi there. What's your video resolution and what sterilization types can be used with this?
Right, great questions. So the sterilization that we are recommending is VHP or STERAD, so hydrogen peroxide. And our resolution out of our receiver is a bit higher than 1080 at 60, but connected to a full 4K system, it actually gets converted to 4K. And we have done human factors analysis around the country. Our video has been told to us independently, so us not being in the room, as good as, if not better than, any system that is currently on the market.
Thank you.
Back to the judges.
So you've spoken to us about how that's going to eliminate cables and is potentially going to improve fire safety. But how do I sell this to my VP of OR operations, who wants to always look at cost as the bottom line? How is this going to help my operating room either operate faster, safer, or at lower cost?
Good questions. Yeah, sorry, I'm just going at it. Sorry, Leah. So I'll actually take a couple examples of that. So number one, from the safety side, the elimination of cables means that you don't have to sterilize them, and they are very intensively sterilized. It's a lot of effort, it's a lot of money to sterilize current cables. By literally just eliminating them, you eliminate that expense. We also have internal data that shows that 30% of all claims for injury in operating rooms.
Workers' comp can.
Oh, workers' comp, sorry.
Workers' comp
Thank
claims.
you. Yeah, that all of the 30% of all workers' comp claims in an operating room actually come from trips and falls. And so we have data showing that. So again, eliminating that cable. The fire risk is a huge, by eliminating that, we obviously once again lower the risk to the hospital. But then the other side of it, as I mentioned, is that if you can set your surgery up faster and take it down faster, we've had actually surgeons come to us who are part of ASCs, and they have told us, based on our internal timing and how much it takes us to set systems up and take them down, we believe with your system, on a per surgery basis, we will be able to conduct additional surgeries, which is a huge revenue driver.
So you have an impressive group of investors from the orthopedic community. So there are obviously a lot of features to your product that they're impressed by. I'm curious if you've gotten any suggestions about product redesigns or improvements, and if so, what are those suggestions and what are your plans to address those?
So that's part of the reason we're here, so I appreciate it. We've been on the floor since the exhibit floor opened and talking to surgeons out there. Really, the questions and the comments that we received back are about the depth of field for doing a laparoscopic surgery, so being inches away from the organ rather than millimeters away from the bone, so the difference between the types of surgeries. And that's an optimization of the image process. So with the feedback, as we've done in the orthopedic space, we continue to optimize our software, our firmware on our device to be able to service the different physician groups and the specialties. So that's, as I said, why we're here and why we want to do demonstrations. We want to talk to surgeons. We want their feedback, and we want to be able to make our product better and work better in their surgeries.
Great. Let's give a big round of applause to Lazurite. Thank you, Eugene and Leah.